Dawn, why are you so excited about Intermountain's outpatient programs?
I like to think of our outpatient programs as something similar to physical therapy in the medical world. When someone breaks a bone, they typically have some type of physical therapy incorporated into their process to heal and strengthen it. In the mental health world, outpatient therapy is structured to strengthen the emotional and mental well-being of individuals who need a little extra support in times of stress.
And what kind of issues do you see people dealing with in your outpatient programs?
We have quite a variety of issues that we work with in the outpatient programs, including depression, anxiety, bipolar. We have some schizoaffective disorder. We also help individuals on their path to recovery who are struggling with addictions, and that could range from alcohol to gambling addictions.
Okay, and give us an idea too. What does a typical day look like in a program?
Patients normally come into the programs and will check in with either one of the receptionists or the social workers that are on staff, and they will have a meeting on at least one time a week with the medical providers or the nurse, and then they will follow up with classes with the social workers.
And tell us too about your providers. So who are they and what do they do for your clients?
The providers we have are Dr. Timashai, who is the medical director. He monitors and works with the clients individually, as well as Jeremy Hurst, who is our psychiatric nurse practitioner.
Great. All right. And so tell us too about the support. So what other support do clients get for medical needs?
We do have a nurse on staff that is available for clients when they come into the outpatient programs all day long. She helps act as the liaison between patient and medical providers who may be in another unit on campus. Or we have the social workers who also are there to help support and facilitate clients' needs.
Great. And also too, I know some of your outpatient programs are done virtually, like we're talking right now, and it's done through telehealth. So why does this option work so well for this program?
Well, thanks for asking. I have to tell you, that's my personal baby, so I'm super excited to introduce the virtual aspect of our outpatient programs. We have the ability to reach clients across the state and people who may be homebound for a number of reasons. Maybe they have physical restrictions that they can't get out of the house, back to that broken bone kind of idea. Maybe they have appointments throughout the day and they need something that is easier access.
And I have to know too, what are some of your favorite therapy groups with your clients and why?
I concur with a lot of my clients that the two most favorite classes that I teach in the virtual world include Food and Mood, which addresses dietary needs that may be being overlooked, and we talk about how to prepare things and how to store and save things. We also have what we call pop culture therapy, and that really is inclusive about our environmental stimulants that are out there in society. Maybe it's a song, maybe it's a billboard, maybe it's a magazine article or a story that has an impact on your belief system or your values, and really gives us an opportunity to talk about what does that look like in your life.
Wow. Okay, this sounds like some incredible programs. I'm loving this. Where can our viewers go though to find out more and if this is the right fit for them?
They can call us 24/7 at 208-377-8400. They can see us online at intermountainhospital.com, and they can also schedule an online assessment.